Good morning. This is Mortality with me. I thought I'd go over some of the data at the CDC dashboard. I'll provide the link in the notes on the video. And today I want to focus in on cause of death, non-COVID cause of death. I'm going to update the dashboard and we'll start with the entire United States. So to orient you to these graphs, the light gray lines, each line, so I'll just do the circulatory disease. This gray line, each one is a year, 2015 to 2019. And then there is a red line above, that's the 2020. There's an orange line, which we're going to ignore because we don't have enough death reporting yet. But for the full year 2020, we're 2 months into 2021. The data are pretty good. Yes, we know North Carolina is missing and stuff like that. But, we have stuff to look at, and I'm going to focus in on a couple of these causes. If you read all of the fine print on this page, one of the reasons for breaking this out, there can be secondary effects from lockdowns and from COVID and yada yada, but in some of these cases, particularly this spike here, which is when the spike for COVID occurred, many of us are arguing that's really just undetected COVID deaths, that no, it's not simply a heart attack. It was a heart attack that was ultimately caused directly by COVID. But there's also a few other things. You see a little hump going over with other select causes, the hump for Alzheimer's disease, and I have argued in that first wave that a lot of those Alzheimer's deaths were really nursing home patients who really died of COVID. But before we really get into that, I want to point out a couple of things. And the one thing I want to point out, and it's hard to see because it's kind of in that gray, is the seasonality of deaths for some causes, but other causes of death don't really have a seasonality. And let me just point out, we are not surprised that respiratory diseases, so flu and pneumonia, have a peak at the beginning of the year and kind of, at the very end of December, but it kind of peaks mid-January, a few weeks into the year that you get your peak of flu deaths. What you might not know is that there's also a seasonality to circulatory diseases. So more heart attacks, just more all sorts of heart disease deaths in the winter. And again, beginning of end of year. And no, it's not merely Christmas and New Year's. You can see there's like this curve that it dips low in the summer and it's worse in the winter. Okay? It's hard to miss. Alzheimer's disease and dementia also has some seasonality, but look at malignant neoplasms, which of course is cancer. That is flat. There is no seasonality to cancer deaths. Isn't that interesting? Now, part of this can be the age structure, that the seasonality of deaths is really driven by the seasonality of deaths of old people, and that they are at their most fragile in the winter and in their best health in the summer. That could be. For cancer, of course, you have more people of all ages. Cancer is a higher cause of death for younger people because, heart disease isn't really kicking in and killing them as much. So it kind of kicks in at middle age as the top cause. So let's see. I do want to dig into specific locations. I'm going to start with New York City. Sorry, guys. Yeah, I don't want to laugh at it, but when you see a pattern like this, okay, yes, heart attacks kill rapidly, but, people were going to the hospital for heart attacks and stuff. I really think this spike of, and it is heart attacks, and we'll see that in a moment, that's really caused by COVID directly, that someone, and they noticed that in some of the COVID cases, you get blood clots, and of course that means your cardiac artery could get blocked, you have a heart attack, you're dead. And some of it is, look at what the low level is. It's about 500 per week, and then it peaks to about 2,000. That's a pretty big indication. We probably miss cause of death there. Respiratory diseases, now COVID, of course, came across as a respiratory disease. People were having trouble absorbing oxygen. But, it sounds like it's kind of mainly a blood disease in that that the blood can't absorb the oxygen so well. Anyway, notice cancer is flat. Alzheimer's has a little bitty, and in other select causes has a little bitty, and then it's otherwise flat. Then let's do the rest of New York State. More noise, and isn't that interesting? We have that first spike for circulatory diseases and respiratory diseases, but you notice there's a lot of noise, which is, it's just kind of interesting that you see that here. Okay, so let's start with our most populous states. We have California. Now, what's interesting is we do see some elevated circulatory diseases kind of summertime. And also, well, we normally have it go up in the winter. This is some excess. You'd really have to do a statistical analysis. There does seem to be some excess on Alzheimer's as well in California. There's a lot of noise, so it seems somewhat elevated for Alzheimer's disease. Now, again, that's not a spike. That is kind of a high elevation of deaths there. So what could be going on? That could be increased deaths of people, say, in nursing homes where it's locked down and they don't have visitors. This is going to take time to tease out. I'm not saying it's this thing or that thing. It still could just be COVID killing people in nursing homes. And they just assumed that it was Alzheimer's because they didn't get tested. Here's Texas. Now, Texas had its first wave in the summer, and we see that increase in circulatory diseases. I am thinking that is undiagnosed COVID deaths. And Alzheimer's, we kind of have a ramp up and down, but it is somewhat similar to that California pattern we saw. Then we'll do Florida, and I will stop at that point. So Florida, remember, they had their first wave like Texas in the summer. And yeah, we see those circulatory diseases going up and down. That was the same pattern as the COVID deaths. I think that's undiagnosed COVID. It's not that they're worse in Florida, but, that's pretty clear. Remember, of course, Florida skews older than Texas and California. I want to see what Arizona, I actually hadn't looked at Arizona before. Is it going to give me Arizona? Ooh, it's thinking. That's not a good sign. Okay, so Arizona had a bad COVID wave in the summer, and again, we see that circulatory disease come up and down. So when you have, say, a big wave, I would say it's just too easy to miss some of the COVID deaths, and especially if, they died because of a heart attack. Are you really digging? How far down that chain are you digging to find out, oh, it was COVID that killed them if they had never gotten tested for COVID? So that was the big cause group. Let's go to subgroup. And I have to update the dashboard, sorry. I want to look at the whole US. Okay, so now they take those big areas that we were just looking at and break it down into subgroups. Sorry to say, like for Alzheimer's disease and dementia, all you get is a focus in, and let's look, this is the entire country, remember. It goes up in that first wave, and then it's kind of elevated for the entire rest of the year. This is concerning to me. Now, that could be COVID deaths, but when I'm looking at it here, and it's kind of constantly above, if we dig into specific states, so let's look, I'm sorry, I don't mean to keep laughing, it's just that I know what this is going to look like. So here's New York City. We have that spike and it comes down. And notice that it's pretty level after that. New York City's pretty locked down if you're in a nursing home or a hospital. So here's New York State. It doesn't spike the same way. It kind of goes up and then comes down and farts around for a while. Let's look at California. California, we are seeing kind of just an elevated throughout. that should be investigated. Yeah, that's not, I don't think those are COVID deaths. That can be the result of policy, and it also might be their care isn't as good. Good. I don't know. I'm not saying it wasn't as good. It's just that could be another reason. It could not. Oh, yeah, Texas. Yeah, that's not looking good. Yeah, that's elevated throughout for Alzheimer's. I don't think that's COVID. Let's look at Florida. And Florida is kind of elevated throughout, but it does seem to have its biggest peak in the summer in the August when Florida was having its peak of COVID deaths. That said, yeah, we are seeing an increase of Alzheimer's disease and dementia deaths in 2020. That should be investigated of what's really driving that. Some of that, like the New York City one with the spike, that was almost definitely COVID at the nursing homes. But for other things, you know, that was pretty constant, and it can be due to social isolation. So I don't like the look of this. Now, I noticed another pattern. I'll show you malignant neoplasms just because it's nothing. No effect on cancer deaths, period. People have asked me, do you think because people are missing cancer screenings, and yes, people miss cancer screenings, that we will be having more cancer deaths in the future? And we may, but for a lot of cancers, only a few cancers are fast moving, and they tended to have bad prognoses to begin with. That said, cancer treatment is getting better. Stewart himself had his cancer caught fairly late, but it had to have been a pretty aggressively growing cancer given his previous screenings and his age. So yes, I think there will be some marginal increases in cancer death rates. I should say rates, not necessarily count. But fortunately, there's not a lot of people who get the fast-growing cancers. Most of them are slower growing, and they will still probably be caught early enough on. There may be some people whose stage of cancer is caught a little later than normal, but the prognosis is still good. So, it remains to be seen. Sorry, guys. I want to get into this other select causes because I noticed something talking with Stuart yesterday, and that's the diabetes. Renal failure, so that's kidney disease, sepsis, so that's infection, and these are not necessarily very high causes, but they are top causes of death in normal years. But look at this diabetes graph. Look at that. That's, oh my gosh, that's elevated throughout, and that's another thing that really needs to be investigated. Is it, again, that first run-up that can be someone who is diabetic? We've heard about the comorbidities. That needs to be investigated more, by the way. When we've seen the reporting of comorbidities, it's just been that someone had the disease, had COVID, and had this other condition. And they can, of course, have multiple conditions, diabetes and high blood pressure and obesity, etc. These are not independent conditions. Obesity and diabetes are pretty closely linked, okay? So that's part of it. But the other part is whenever I see these tables, I know some people have done the research, don't get at me for this. You will see them making comparisons such as this percentage of the deaths were of Black people or Hispanic, and this was the percentage of the population, reference population we're looking at. No problem. There are disparities. That I don't disagree. But when they are doing the comorbidities, they don't tell me how many in the base population have that condition. If you say, well, 30%, I'm just making numbers up, by the way, 30% of those who died with COVID had diabetes, and then you say, well, how many cases? So at the very least, how many people with COVID had diabetes? Was it bigger or smaller than 30%? And then in your base population of the whole population, what percentage had diabetes at that age group? Because age, we know, is the biggest factor in mortality, whether it's COVID or something else. So if we look at diabetes, I do want to dig into the state. Let's start with New York City. We see a spike like that. That's almost definitely not diabetes. That was probably COVID. It was just somebody with diabetes who died of COVID. Okay, that one's simple. New York City always makes it simple. New York State is where it starts to go messy. We do see it kind of go up and down, but it is still elevated. Is it COVID that they're missing, or is something else going on? And that might be the situation. Let's look at California. Yep, we see some elevated diabetes deaths. Let's go to Texas. That definitely now, again, we see in the summer, we're seeing the greatest excess when there was the greatest excess of COVID, but it remains elevated. I am wondering, and then I'll go to Florida. I am just wondering, is there a situation with people with diabetes who are not, that's a chronic condition that needs monitoring. I have both type 1 and type 2 diabetes in my extended family. So I am at risk I'm not diabetic yet, but I'm at risk for diabetes. Obviously, I'm obese. This is something I have to worry about. Even if I weren't obese, and some of my non-obese family members have gotten either type 1 or type 2 diabetes. It's something that runs in our family. I look at this and I'm like, is it that they have excess that's coming from COVID deaths all this time? We also have to look at this number. The base here is around the magnitude of 150 per week. So some of it could just be noise. Some of it could be a bunch of people moving to Florida who have diabetes. I don't think that's what that is. That really needs to be dug into. If we go back to the United States, this all, evens out, and we see there's this excess diabetes mortality that really we need to tease into it, see if it really is COVID that we're seeing or something with diabetes. Anyway, stuff for y'all to think about.